Well, we're going to start. Welcome to our Sisters in Christ program on hypertension and heart disease. Why do we do these programs? Knowledge and information. Yes. Save lives. Yes. Awareness. Yes. Don't ignore it. And also to share. Because many times we go through a trial and we think we are the only ones going through it, because that's how the devil wants us to think. And so we kind of hide it into our bosom, and you get more discouraged because he can attack you more because you think you're the only one going through something. And when you talk to somebody else, you realize, wow, this person is going through either the same or something similar, and you're able to do what with each other? Share and release and encourage and inspire and pray, right? Two things stand out to me. One was a long time ago, a sister was coming to this church, and Dr. Ray gave a health talk on breast cancer. And after hearing that, she went to the doctor and she was diagnosed with breast cancer. To this day, and she moved away a long time ago, whenever we communicate, she always says to thank him. And it always stays in my mind, because you hear something and it triggers something that you're going through, and you can find out. And what do we know? Early prevention is very good, right? Also, too, one of my sisters went to the doctor with her daughter. And she said to the doctor, I just have a question to ask about me. You know what the doctor said? Make an appointment and come back. And that just stood out, it just blew my mind, because you're sitting right there, just a simple question about, and she said, make an appointment and come back. So what I learned from this is that information is not free, right? And so when we are doing a program, we're giving you free information. I cannot call any of my doctors and say, something is hurting me here. Could I just talk to you about it? No. First, I won't get to talk to my doctor. Somebody will answer the phone, and they'll say, what day are you available? And I'll take my copay and go, right? And so this is a gift when we have programs like this, where we can get free information, we hear it, and then we can also ask something about what we're feeling, right? And also to share. Okay, so Dr. Ray is now going to give us this health talk, and afterwards we will have a discussion. You can ask questions.
Good afternoon, everybody.
Good afternoon, Doctor.
Well, Claude said this would work. It didn't change, Claude. It did?
Another senior moment.
It's working? There it goes. That's it. That's my first slide. So today we're going to talk about high blood pressure. And the reason why I think this is so important is because, it's Heart Health Month, but you're not hearing so well? But much of what you think of as heart health is, or the diseases of the heart happens because of high blood pressure, right? And so the two are intricately related. If you have high blood pressure, you have a much higher chance of having heart disease. Not just heart disease, but as you will see as we continue to talk, just about every major organ in your body can be damaged by high blood pressure. Some are more common than others, and we're going to talk a little bit about those today. But first, before we talk about the effects of blood pressure, it's important that we understand what blood pressure is, right? So, what exactly is blood pressure? Well, when your heart beats, it pumps the blood, right? And that blood goes into your arteries. Well, that's basically what your blood pressure is. The force of the blood in your arteries. Now, there's two parts to blood pressure. Do you guys know what the two parts are? So, there is you know, there is the systolic blood pressure. That is when the heart is pumping. And then there's diastolic. So smart. And there's diastolic, right? And that's when the heart is relaxing. So that the higher number, 120, is systolic, and the lower number, or 80, is the diastolic blood pressure. And that's what we like your blood pressure to be at, 120 over 80 or less. Now, this is where the problem comes in, right? So, but keep in mind that when you're taking your blood pressure, and most of us should have a blood pressure machine at home, at least the adults anyway, right? You should be able to check your blood pressure not just once a year when you go to the doctor, but every month or two you should check your blood pressure, especially as we get a little older. But there are certain key things when you check your blood pressure. Can you see that slide? Mm-hmm. Right? You should be sitting upright, right? You should be with your back against the chair. Both feet should be on the ground, right? And your arm should be at your chest level. And not just that, but you shouldn't eat anything about 30 minutes before you check your blood pressure, because certain foods will increase your blood pressure, right? Any little salt load will increase your blood pressure. And you should empty your bladder, right? You shouldn't be like, man, I have to go pee, and you're checking your blood pressure, because the pressure will go up, right? Pain will make your blood pressure go up. Stress will make your blood pressure go up, right? Some people, they see a white coat and their blood pressure goes up, right? Every time. Your pressure is quite normal at home, and as soon as you stepped into the doctor's office, your blood pressure goes up, right? So lots of folks are like that, and this is why it's important for you to keep track of your blood pressure at home, right? Take it up higher. So it's important to keep your blood pressure, you know, keep track of your blood pressure at home. And that becomes very helpful to us. Not just that, but make sure you have the right size cuff. If the cuff is too big for your arm, your blood pressure will be falsely low. If the cuff is too small for your arm, your blood pressure will be falsely elevated. So you need to make sure you have the right size cuff for your arm. That's also very important. Now let's go back a little bit to the blood pressure. Now, systolic blood pressure of 120 and less, and the diastolic of 80 and less, is what we call normal blood pressure. A blood pressure of when the systolic is between 120 and 129, or the diastolic is 80 or less, that's what we call elevated blood pressure. We haven't gotten to high blood pressure yet. High blood pressure is the systolic of 130 or higher, and a diastolic of 80 or higher. And this is very important, huh? Yes. If you're in the hospital, that will happen. But it's important to keep in mind, it's not just a number. What does the last four words say? It has to stay that way over time. Right? Because remember I said sometimes it may go up if you eat some salty foods or if you see a white coat or something. But if you're home and it's above 130, your systolic, and above 80, your diastolic, and then you check it the next day and it's the same, and the next day it's the same, then that's more consistent. So we never say you have high blood pressure by checking your blood pressure once, unless you present in what we call crisis, where your pressure is super high and you have evidence of what we call end organ dysfunction. You're having a stroke or a heart attack and these kinds of things. But that's a whole different thing that we'll talk about in a little bit, okay? So, why is hypertension important for us to talk about, especially in black people? Because black people in the United States have one of the highest rates of high blood pressure in the world. Which means half of the adults in here probably have high blood pressure, right? Half. We have much higher blood pressures than non-black people. And not only that, black people get high blood pressure earlier than non-black people. We suffer the damages from high blood pressure much more than non-black people. And so everything about high blood pressure is worse in black people. Well, we can talk about that in a little bit. Lots of reasons. Lots of reasons, and we'll talk about it. The big thing people talk about now is what they call social determinants of health, but there are whole lots of other reasons. And we'll talk a little bit more about it in a second. Remind me, okay, so we can talk about it in a second. And African American women are 50% more likely to have high blood pressure as compared to non-African American or white women. So you can see why it's just a devastating thing. Now, you know, that question was a very good question. What are some of the risks for hypertension? That falls into the risk category. And that you hear this term social determinants of health. And there's you know, lots of, you know, literature on it. And it has to do with a lot of black people in this country tend to live in lower socioeconomic, tend to be in lower socioeconomic groups, tend to live in neighborhoods where access to certain things is less. The poorer neighborhoods tend to have stores with more fast food stores, right? Fast foods tend to have higher sodium in them. The poor neighborhoods tend to have stores that don't have, you know, high quality fresh foods and stuff like that. And so, you know, the lower socioeconomic and poverty-stricken areas tend to have dietary patterns that are not as healthy. And all of that contributes to high blood pressure in black people. But also, there's a hypothesis. Some medications for blood pressure doesn't work as well in black people as others. And lots of theories to that too. One of the theories is this: when slaves were being brought from Africa, you know, the ones that survived were ones that were able to deal with salt better. When you're able to reabsorb salt, water goes with it. So they got less dehydrated and they died less. But that same quality that kept them alive on the transatlantic thing is what contributes to higher blood pressure now. So it kept them alive on the trip, but it contributes to higher blood pressure. And this is also one of the, so our kidneys are more sensitive to the negative effects of salt. And so that's one of the reasons why, you know, we respond in a more negative way to higher salt diets than other cultures, right? So there's lots of different reasons. That's a big hypothesis that's been out there for quite a while now. So it's multiple reasons that contribute to it. And I just want to quickly mention this social determinants of health again. And because they're saying it's one of the reasons why we have a higher level of hypertension in our communities, right? These social determinants of health also lead to low birth weight in babies. Low birth weight babies tend to have high blood pressure as adults. Increased risk of high blood pressure as adults. And one of the reasons why they call this social determinants of health, because it has to do with the environment in which you're existing and living, right? If you're in a poor environment, you may not have grocery stores with as much healthy foods as in some other areas. You may not have access to a park where you can go walking and exercise as easily as other people. So all of those things come together, and they say this is definitely a contributor, because when you look at black people who come from outside of the U.S., immigrants, they don't have the same level of high blood pressure. They don't have the same degree of low birth weight babies. And they tend to live longer, 8 to 10 years longer than black people who were born and raised in the U.S. Okay, so so all of those things are part of this whole social determinants of health. Now, a little bit more about it. So lack of access to care, lack of access to healthy foods and other societal type things, lack of access to medications, and I got to be honest, black folk just don't trust the medical world as much, right? There's a historical kind of distrust that black Americans have of physicians. Lots of reasons for that, right? You guys have heard things like the Tuskegee, right? Where they were experimenting on black people. Even like in Columbia here in New York back in the day, they were experimenting on pregnant women and these types of things. So black people historically tend not to trust, or there's less of a trust in the medical professionals. And part of that leads to them not getting checked up on a regular basis, not getting evaluated, not taking their medications the way they're supposed to. All of those things contribute to the bad effects of hypertension. That's one of the reasons why we tend to suffer more from the negative effects of hypertension, right? So I mentioned before that certain medications just don't work with black people because their kidneys are different. Those of us who survived the trip from Africa, it's because their kidneys were different. And so that also is one of the reasons why certain medications don't work with us. Now, what are some of the factors that lead to high blood pressure? Huh? Stress, right? The big ones, though, are like obesity and diabetes, right? Our diet is also a big one. And we just suffer. We suffer disproportionately higher rates of obesity and diabetes, and they contribute to high blood pressure, so we suffer disproportionately higher rates of high blood pressure. And it's the reason, the danger with this high blood pressure is that it's the reason why it's called a silent killer. Is because you could have super high blood pressure for years and not know anything about it. Actually, most of the people who have high blood pressure usually don't even know, because they don't get their blood pressure checked on a regular basis. And damage is being done, but it's just a slow, insidious type of damage. And it's amazing how God made our bodies. It can tolerate a lot of stress until it can't tolerate it anymore, right? And so the damage to your kidneys can be slow and progressive. And you may not know until your kidneys start to fail if you're not getting your blood pressure checked or your kidneys checked. The heart, the damage to the heart is also slow and progressive. And you may not know until, I think it was Dr. Donna said today that, the first time you may know you have heart disease is when you have a heart attack. Well, the first time you may know you have hypertension is when you have a stroke or you have a heart attack. And then you find out your blood pressure was very high. Or you may not know you have hypertension until your kidneys start to fail or your heart starts to fail, right? There may not be any symptoms. You may have symptoms, but sometimes the reason why high blood pressure is called a silent killer is because sometimes you have no symptoms, right? You may not have any symptoms until something bad happens. And then you realize, oh my goodness, I have high blood pressure. Or we do a know your numbers, or you take a random test somewhere and your blood pressure is super high. And the person taking your blood pressure, their eyes bug out like this, and they're like, you got to go to the hospital right away, right? You scare them because your pressure is so high. And I call it, you're walking around with a ticking time bomb in your head and in your heart, right? Because that's how bad the blood pressure is. Now, what are some of the things we can do to overcome the challenges of high blood pressure? We'll talk about that first, and then we'll talk about what happens if your blood pressure is unchecked, if you don't take care of it. One of the biggest things we can do is a lifestyle change, a healthy lifestyle change, I should say, right? A healthy weight. You need to know what your numbers are. What's my BMI? Am I obese? Am I overweight? Am I morbidly obese? And losing weight. And I can tell you from my experience, the vast majority of people who have high blood pressure and even diabetes, if you do a couple of things, you're very likely to get off medications. If you lose weight, if you decrease your salt intake, and if you exercise 3-4 times a week. But what's the problem with those three things? It's very hard to do, right? Consistently. You may do it for a week or two and then you fall back, right? And that's the problem with us. Because it's so hard to be consistent in those things, it's hard for us to get off, to manage our blood pressure naturally without medication intervention. Okay, so that's one of the issues. People struggle with those things because they just find it very difficult to do. And of course, in black neighborhoods, we talked about the lack of stores that sell healthier foods and these kinds of things. And access to social support and safe environments, all of these things become important. But one of the other things I really wanted to talk about was, obviously, as Adventists, we don't smoke. But you have to avoid secondhand smoke. So you may live with someone who smokes, and secondhand smoke is also very bad for you. But one of the most important things I want to talk about is our consumption of salt or sodium. That's a big contributor to blood pressure. Some of us confuse taste with salt, or flavor with salts. And that's huge. And they're saying we should really regulate our salt intake. It should be 1,500 milligrams per day, or even better, 1,000 milligrams per day. And if we can control our salt intake, that will help a lot with controlling our blood pressure or keeping or maintaining a healthy blood pressure. Also, I talked about losing weight. Many of us are overweight, and so losing some weight really helps. And exercising, increasing our physical activity. Many of us are couch potatoes, and it's very hard to exercise. And when I say exercise, I don't mean necessarily going running, right? Not everyone can go running, but almost all of us can go walking.
Yeah.
Right? And walking is such a good exercise. And some people may find it hard even to go walking. So you can get one of these little stationary, bikes or something, so you don't have to go. There's some that are just the feet part go like this, right? Whatever, but you gotta increase your activity level. You gotta, exercise. And of course, eating a healthy diet and eating more fruits and vegetables and grains is also very important. And I have a slide that kind of show you some of the sodium content of this in a second. I know some people are like, oh no, Dr. Ray's going to talk about vegetarian stuff. Yeah, I'm a vegetarian, that's true. But I'll show you too, some vegetarian foods are just as bad for you, right? So you still have to be careful when you're monitoring your sodium intake. Now, how much sodium does certain things have? Well, the biggest form of sodium that we know of is salt, right? Salt is sodium chloride. And so the sodium is a big component of it. And so you can see 1 teaspoon of salt has, over 2,000 milligrams of sodium. And what did I say is a healthy level of sodium per day? 1,500, right? So if you have, 1 teaspoon of salt per day in your diet, you're already above what we call the healthier doses of sodium, right? And that's why, that's the problem. So processed foods and soups and, and pizza and these kinds of things have lots of sodium in it. Now, you may not think of it, it's important for us to think of it this way. If you're eating 3 meals a day, your breakfast may only have 200, 250 milligrams of sodium, but your lunch, a sandwich or some soup, that already goes above what you need for the day. And then you add dinner to that, and before you know it, you'll double what you should have for the day. Double the amount of sodium. And if you're doing this every single day, you can see how it's going to be very difficult for you to control your blood pressure, right? Because you're just feeding it with sodium, and that's a really bad thing. Look at this. There's lots of things here, right? I'm sure many times we don't really think of how, apart from a tablespoon of salt, you can see, but we don't eat cured ham and these kinds of things. These preserved meats have lots of sodium. But some of these things you may not think have a lot of sodium. Look at a pickled cucumber, right? It only has like 17 calories. And you may say, well, it only has 17 calories. It's super low calories, but look how much salt it has, right? It has more than what we would consider for the normal amount of control per day, right? A lot, way more. And certain cheeses, even things like teriyaki sauce, you see how much sodium it has. And look at, on the other side, you see some of the fruits and vegetables. They have a much lower content of salt in them compared to the pickled cucumber that has, a whole lot more, or just regular salt, right, which has a lot more sodium. So you can see by paying attention to your diet is the only way to control the salt intake, right? Look at the sodium content of whatever you're eating. If you have high blood pressure and it's being very hard to control, you have to pay attention to your diet. You have to pay attention to the sodium content in your diet, because that's one of the reasons why it's very difficult to control our blood pressure. You have to try and lose weight. You have to try and exercise more often. Those are the things that will help us bring our blood pressure under control and hopefully prevent you from going on medications or getting off, or helping you to get off medications. Are you guys following me? Right? So even some of the over-the-counter medications have lots of salt in them. So this is why it's important to pay attention to the sodium content. Alka-Seltzer and these types of things, right, have lots of salt in them. And so it's important to pay attention to those types of things also, right? And I was going to add this here because you can see some foods have lower salt options. There's medium salt and there's higher salt. And the top one you can see, right? Fresh poultry and eggs and stuff have low salt options. Lots of cream cheeses and processed meats have much higher salt content. And as you can see on the bottom, the vegetarian alternatives, you can see if you have, tofu or beans and vegetables and these types of things, it's low content. But once you start going to some of these, like, vegetarian, like preserved meats and stuff, the canned burgers and sausages and stuff, you can see it has a much higher, medium salt content, and pastries and cheeses and stuff have even more salt content. So being a vegetarian doesn't mean you're eating less salt. There are overweight vegetarians too, right? But so you have to be careful with that. Blake? Yes, the women's ministries, Sisters in Christ have handouts. I know this is hard for you to see, but this was a refresher of what the normal blood pressure is, what elevated blood pressure is, what high blood pressure stage 1 and high blood pressure stage 2 and hypertensive crisis. We hope that none of you ever get into that hypertensive crisis part, because that's the really, really severe part of having uncontrolled high blood pressure. And if you are elevated, there's lots of little things you can do. What we talked about, lifestyle changes. If you are stage 1 or stage 2, mostly lifestyle changes will keep you off medications. But stage 2, people who are unable to do those things we talked about may need to start taking medications. And when I say medications, especially for black people, these thiazide diuretics, like hydrochlorothiazide and these kinds of things, and calcium channel blockers like amlodipine and those things, they tend to work better with black people. And so if you go to the doctor and they say, I think you get, and they've been trying to get your blood pressure under control with weight loss and diet and these types of things, and it's not working, they may start you on 1 or 2 of these medications. And they may check your blood pressure, tell you to come back in a couple of months to check again and see how you're doing. And some people may need 2 medications. Some people are on 3 or 4 medications because their blood pressure is so out of control. But it's so important that if you're given medications to control your blood pressure, that you take it. It's very hard to take medications consistently the way you're supposed to, especially if you got to take it 2 or 3 times a day. It becomes very hard to do. But it's so important that you do. Some of these blood pressure medications, when you stop taking it, you get what is called a rebound hypertension, and your blood pressure can shoot right back up, which is worse than before. So you don't want that either. So it's really important that you follow your doctor's or your pharmacist or any other healthcare professional's advice when you get put on these medications. I just very quickly, I wanted to show you this, right? So your age and whether or not you have like kidney disease or chronic kidney disease or diabetes all affect what type of medications you get put on, right? Lots of doctors will follow these algorithms. Now, what are some signs and symptoms of uncontrolled hypertension? Well, if your blood pressure is uncontrolled and it's left to persist, remember I said it will continue, it will damage just about every organ in your body, right? Then you start having problems. Problems of end organ dysfunction is what we call it. So you may have problems with seeing because the high blood pressure damaged the vessels in your eyes or cause bleeding in your eyes. You may have dizziness or lightheadedness. You may have headaches. Some people have nosebleeds. It's not that the high blood pressure causes nosebleeds, but the high blood pressure causes the blood vessels in the nose to become very fragile. And so they crack or break very easily. So lots of people with high blood pressure will have nosebleeds. And then when you have a nosebleed, you get stressed and your pressure goes up even more. So when you come to the emergency room, the blood pressure is high. And you automatically will say, oh man, my blood pressure is causing a nosebleed. But it's not so much the blood pressure causing the nosebleeds, it's the blood pressure causing these other things, right? Shortness of breath is a big one. Chest pain. If you have high blood pressure and shortness of breath or chest pain, or you need to see the doctor. Now, what are the 4 most common areas that are damaged by high blood pressure? The heart, the kidney, the brain, and the eyes. I said the high blood pressure will damage the blood vessels in the eye or break them and cause bleeding or decrease blood flow to the eye, and that will cause, decreased vision or sometimes even blindness. It's called hypertensive retinopathy, right? The retina is the back of the eye where the image is focused on that area, and when the retina is damaged, you're not going to be able to see. Right? The high blood pressure can damage the blood vessels in the brain, can contribute to atherosclerosis or, a buildup of plaque or in the blood vessels and decrease the blood flow to the brain. And so you can get a stroke. Or you can contribute, the pressure can make, what happens if there's pressure in a tube and the pressure gets very high? What can happen to the tube? It can burst, right? So when the tube bursts, that's called a bleeding stroke or a hemorrhagic stroke. And those are also tend to be very bad. High blood pressure also can damage the kidneys. And what does the kidneys do? The kidneys filter the blood. But if your kidneys are so badly damaged that they can't filter the blood anymore, what happens? You have to go on dialysis, right? And dialysis is an artificial filtering of the blood. And that is never a good thing, right? And some people may need to get a kidney transplant. Because dialysis is not a good thing, right? It's a very, we don't like that at all. And if your blood pressure is very high, your heart, it's a very vicious cycle. The heart contributes to a normal blood pressure, but when your blood pressure is too high, the heart has to work even harder. And the heart is a muscle. Remember, Dr. Blake said, the heart is just a little bigger than a fist, but if your pressure is high, the heart has to work much harder to get the blood out of your heart into the rest of your body. And what happens when a muscle starts to work harder? What happens to the muscle? It gets tired, but it also gets larger, right? It hypertrophies. And so the heart muscle will get larger to compensate because it's trying to increase the force against the high blood pressure, and it will get larger and larger and larger until it fails. And when your heart fails, we call that heart failure or congestive heart failure. And then if your heart is not pumping blood very well, that blood liquid fluid backs up into the lungs. And then you get something called pulmonary edema, and that will make you short of breath. Right? That will make you short of breath. When you come to the hospital, we have to get rid of that. We have to either increase the force of the heart, make the heart pump better, or decrease your blood pressure, or diurese. Diurese, give you medications to get rid of the fluids. And so you can see how the high blood pressure contributes to all of those bad things. Everything I've told you so far is very bad. You don't want any of them happening to you, and the high blood pressure, it contributes to all of them. Right here again, you can see high blood pressure damaging the brain, the eyes, the kidneys, the heart, and it even it damages the blood vessels pretty much everywhere in your body, right? And this is why sometimes people will have atherosclerosis or blockages of blood vessel, peripheral vascular disease, and the flow of blood to the legs or the feet become very bad, and then they end up having an amputation, or they end up having poor circulation in the legs. Well, the same thing, the blood vessels go all over the body. So high blood pressure can damage blood vessels all over the body, and you can suffer the consequences of that, right? So here you can see again, it can damage our brain, it can damage our eyes, it can damage our heart, it can damage our kidneys, it can make the blood vessels expand and balloon out. Have you heard of something called an aneurysm? Right? High blood pressure contributes to that. An aneurysm is when the blood vessel balloons out. So the blood vessel might be this big, and then it balloons out to like this. And if it just gets weaker and weaker, and sometimes it can rupture. And if the blood vessel ruptures in the heart or the aorta or in the stomach, you gotta get surgery right away, because if you don't, you'll bleed to death, right? If you cannot make it to the hospital, you'll bleed to death. And even if you make it to the hospital, it might still be too late, right? It doesn't take long for a large blood vessel to empty all your blood out, right? If it ruptures. And so there you can see how dangerous these things are. And here you can see the heart, how it just gets, the left side of the heart starts to work even harder, and then it gets larger. And you can see heart disease contributes to 75% of all heart attacks and strokes, right? And high blood pressure is the biggest contributor to heart disease. So you can see how they're all related, right, with hypertension. Now, there are some more complications of hypertension. You can see, right, the brain gets affected, the blood vessels, the kidneys, the eyes, the heart, even the bone. Did you know that high blood pressure even contributes to like osteoporosis and stuff? A lot of different things can cause osteoporosis. As a woman gets older, right, as estrogen and hormone levels change, all of those things contribute to osteoporosis. But high blood pressure does too, because of the effect it has on the kidneys and the resorption of calcium. That can all get affected and cause osteoporosis. Now, here just a little bit more of the bad things that can happen, right? If the brain is being affected or the nervous system, CNS is central nervous system, then you can get dizziness, you can get nausea and vomiting, you can get confusion and weakness and what they call encephalopathies. When the brain gets so high, there's a little swelling in the brain and you come in, you're altered, you may have seizures, you may be in a coma. All of these things can happen, and obviously different types of bleeding can occur from the high blood pressure effects of the brain. And then the eyes, you can see bleeding in the eyes or swelling in the back of the eyes and loss of vision. And the heart, we talked about heart attacks and shock. And the kidneys, we talked about. Some people may not know they have high blood pressure until they go to the doctor and they find blood in your urine, or they find excess proteins in your urine. Right? And so they say, oh, where's all this coming from? Let's do a little bit of an investigation. And then they'll tell you if you have chronic kidney disease and how we can check to see how the kidneys are functioning. So all of those things can occur because of the high blood pressure. And as you can see, when you go into hypertensive crisis, that's a completely uncontrolled high blood pressure. All of these things can happen, right? Good 29% will present with shortness of breath, and 26% with chest pain, and some with headaches, and some with altered mental status, and some with just stroke-like symptoms, right? And so all of those things come from, remember I told you, when the blood backs up into the heart, you get pulmonary edema or heart failure, or the blood vessels in the heart gets narrowed, and so decrease the blood flow to the heart, and you get a heart attack from what they call acute coronary syndrome. And all of these things can happen as a bad result of the high blood pressure. Now, just very quickly, I want to get to some questions, right? In summary, hypertension is called a silent killer. It's called a silent killer because the damage is done whether you know it or not. Whether you feel it or not, it's damaging our bodies. And we talk about all the organs that can be damaged, the ones that are most commonly damaged, and what the damage results in. It's a leading cause, it's one of the leading cause of illness and death in the United States amongst everybody, but even more so amongst black people. It contributes to heart attacks and strokes and blindness and kidney failure. All of those things it may be triggered by high, uncontrolled blood pressure. Remember, we always say an ounce of prevention is worth a pound of what? Cure. High blood pressure is a preventable disease. It's one of the few things that we can prevent. Right? And control. There's lots of things in life we have no control over, right? But high blood pressure is one of those things where, with lots of effort, I'm not saying it's easy. The reason why most people are on blood pressure medications is because it's not that easy to do. But it's one of the things, if we watch our weight and decrease our salt and modify our diet and our lifestyle and exercise and get rest. Rest is also very important, right? Rest is very important. 7 hours of sleep a night is super important. At least 7 hours of sleep a night. I don't know, I was telling somebody sometimes I feel like a hypocrite because I come up here and I tell you guys the importance of sleep, and I know I'm not getting enough, right? But it's so important. People who get good rest tend to have less problems with blood pressure. Because what happens when you're sleeping? The body does what? It rests. It rejuvenates, right? Yes, it repairs itself. The hormonal levels, adjust and circadian rhythm and these types of things. So much is involved when you get good rest. And it really affects your entire body, right? And if you have to go on medications, make sure you take the right medications for you. And that may require multiple attempts and multiple changes until they get the right medications for you. Some people, I may tolerate a medication and you may not because the side effects may be too much for you, right? For some men, especially, they may get impotent and they can't deal with that, so they don't take the medicine. But go back to the doctor and says, I can't deal with this. I need a change in medication, right? Some people if they may take too much of the blood pressure medications, they may get dizzy, the blood pressure may drop low, they may pass out. All of these things, those bad side effects you need to address with your doctor. The medication dose may need to be lowered, or they may need to change your medications. But there's a ton of different medications we can try, but because everyone is different, you don't know how the medication is gonna affect you until you start taking it, right? But when you start taking it, if the side effects are too much for you to deal with, to let the doctors know because they can change it, right? And I mentioned right medications, and I mentioned the importance of rest. So that's the end of my little summary. And if we have any questions, then we can take that for now, huh? Hey, Pat.
I would like for you to explain malignant hypertension.
Mm-hmm. So there's lots of terms now that they're using. They're trying to move away from a lot of these terms, right? We used to have hypertension, hypertensive urgency, hypertensive emergency, hypertensive crisis, malignant hypertension. So malignant hypertension is basically a kind of a hypertensive crisis, right? It's like you're completely uncontrolled. Your blood pressure is completely uncontrolled, and it's just rapidly elevating. And so, these people will tend to present sometimes, if it's not brought under control, they'll have all the consequences, but in a much faster way, right? It will happen much faster with them instead of a chronically, progressively worsening.
Can it be hereditary?
I don't know if malignant hypertension is hereditary, but hypertension runs in families. So yeah, so there's a hereditary component to it, for sure. But I don't know if it's truly hereditary or if it's environmental, or, because like a family, if everyone is overweight and everyone is diabetic and they're unhealthy lifestyle and unhealthy diet, usually the children will be brought up in that environment and have the same problems. So you got to think about that too. Any other questions? Sister Luska?
Lloyd.
I see Gillian.
Please, turn it on.
Thank you, first of all, Elder, for giving us this free
We're not
information.
We can't
We're
hear.
not
Is
hearing.
it turned on? Okay, go ahead.
I just want to say thank you first, Elder, for giving us this free information. Thank you, thank you. Dr. Blake this morning mentioned chronic inflammation. Could you speak to that a little bit, please? And I also wanted to know, why is it when they take my blood pressure on one arm, it's 2 digits over 2 digits, and they take it on another arm, and it's 3 digits over 2 digits? Could you just tell me why, please?
All right, so there's two things you're asking. So, chronic inflammation is a whole other topic, right? We can talk about that another time, but that's a big part, chronic inflammation. The whole inflammatory system, there's a host of different types of chemicals, or inflammatory mediators, thromboxanes and interleukins and interferons and all of these types of things. And if when you get inflammation in your body, those chemicals get deranged and they can affect the body. And they can contribute to heart disease and kidney disease and strokes and these types of things. And so now they're seeing a component of chronic inflammation in all of these different diseases. But if you think about it, remember I said hypertension damages the blood vessels, right? And that can cause an inflammatory reaction. Just like how COVID damages the blood vessels and can contribute to different things. So it's all kind of related. Now, what was the other part? Oh, yes, yes. There's always a difference between right and left. We get more concerned if that difference is really significant. Because if you have like an aneurysm in your body or a blockage in the main part of the blood vessel, you may have a significant difference between the blood pressure on the right and the left. But they're never the same. They may be 5 or 10 degrees different, but usually not more than that. Gilly? Yeah. Yes, sir. Yes. Yes, yes. I see. So a lot of things can cause chest pain. So chest pain doesn't necessarily mean your heart is causing the pain. Your heart is just one of the things in your chest. So your lungs can cause this little irritation or a pneumonia, or we call the pleurisy, a little inflammation of the lining of the lungs, that can cause chest pain. If there's little inflammation of the muscles in between the ribs, we call that costochondritis, that can cause chest pain, right? So, but we get more, heart pain tends to be pressure, tightness, squeezing, and it tends to last a little longer than a little sharp thing. 20 minutes or 15, 20 minutes or more, that kind of tightness, squeezing, pressure in your chest, that's much more concerning to us, especially if it's associated with other types of symptoms like shortness of breath or nausea or vomiting or dizziness or weakness or diaphoresis or sweating. You just suddenly start sweating. Then we get more concerned about it. But having said that, diabetics tend to get silent heart attacks. So diabetics may not have much symptoms. Women may not have too many symptoms. Well, a female may just have excessive tiredness, but it's more than your normal level of tiredness. So, but you may say, man, it's just that I'm working too much. And you may try to rest, but it may be part of the heart disease and a heart attack that's developing. And so our tolerance for working up women now, in these modern times, are higher. But back in the day, a lot of women were sent home because, oh, you're just a woman. Oh, that's just nonsense, And they went home and died because they were having a heart attack, but their symptoms were not the typical type of symptoms that men would get. They were a little bit more tired than usual, or they have a vague, nonspecific pain, and so male doctors tended to ignore it and minimize it. But now everyone realizes that women may present differently, and so we tend to be a little bit more conservative in our approach to a woman coming in complaining of just some milder symptoms. But, so I don't know if that helps, Gilly, but, so different things can cause pain in the chest. So sharp stabbing type pains is less likely to be a heart pain and more likely to be a muscle pain or pleurisy, inflammation of the lining of the lungs or something along those lines. Any other questions?
Dr. Ray, I don't know if it was mentioned before because I came down a little late.
Mm-hmm.
Can you get hypertension from sustaining some form of injury or illness? Do you develop hypertension under those conditions?
Well, I mean, any type of pain or illness or discomfort can make your blood pressure go up. But as you get better, your blood pressure should come back down, right? I can't say yes or no, but it's less likely that an illness by itself, isolated by itself, will cause hypertension. There are usually a host of other types of factors involved.
Okay.
Mm-hmm. Unless you're like diabetic or you're obese, there are lots of things that contribute. Your diet, these things contribute to blood pressure. It's usually not one thing.
Okay.
But you got to keep in mind that back in the day we used to say most blood pressure we don't know what causes it, right? Essential, yeah. It's called essential hypertension. We don't know. It's just a fraction of people with blood pressure that we know that what's causing it. We know like the kidneys are bad, and so that's increasing the blood pressure. Or they have a tumor that's secreting certain hormones like epinephrine, and that's increasing the blood pressure, and these types of things. But the vast majority of people with blood pressure, we don't know what causes it. We know what contributes to it, but we don't know what causes it.
Okay.
So my question is, can you hear me? So my question is, thank you. So my question is, so I have like family history of hypertension on both sides of my family, and I also have some osteoporosis history on both sides of my family.
Mm-hmm.
And I know when I was pregnant, I got eclampsia, and I was like in the hospital for like 9 days because my pressure just wouldn't come down. And when they released me, I was on so many medication. Is that something that might come back? Like, I know you said there's a history of it, and I mean,
Yeah.
I
Did
tried
you
to.
get eclampsia or pre-eclampsia? Yeah, because eclampsia is when you get a seizure, right? Yeah. So no seizure is not eclampsia. So eclampsia, you know, so just for clarification, eclampsia is a hypertensive emergency. Right? Eclampsia is when a pregnant patient in the third trimester, the blood pressure goes completely out of control, and it damages the kidneys, and then they end up getting a seizure. Then we call it eclampsia. Before the seizure, we call it pre-eclampsia.
I didn't get any seizures,
Mm-hmm.
but it was I was going in organ failure.
Yes, so your kidneys were being damaged because the pressure was high. Huh? Oh yeah.
So I think it added to
Yes.
a lot of
for
other
sure.
stuff that was going on. So my question is,
It's gonna come back.
yeah, what should I be doing differently so that I don't, well, I try to eat different, and so, I mean, I'm not vegetarian, but I try to manage what I eat and so forth.
Yes.
But what else can I do to, I guess,
Prevent it
lessen,
from lessen the chances of it happening.
yeah, or delay?
Yes, yes, yes.
Or
No, but same
whatever.
thing, all the things we talked about, right? Those are the things we talked about that will prevent you from getting hypertension or worse than that, or the damage from it. I mean, obviously, you have a higher risk of developing hypertension if you get gestational hypertension. You have a higher risk, that's what, your pressure went up when you were pregnant, right? Or gestational diabetes. Some people develop diabetes when they're pregnant too, right? And so you tend to have a higher risk of developing those things. But the key is controlling the salt intake, like we talked about, exercising on a regular basis and watching your diet and controlling your weight. Those are the things that will prevent the blood pressure from worsening. The goal is to prevent it from worsening. You can't do much about getting pregnant. If you got pregnant again, that may increase the risk also, right? But those other things you can definitely, with lots of, effort, control.
I'm sorry, Dr. Ray. The difference between channel blockers,
Which one?
channel blockers,
Calcium channel blockers?
yes, and what are the other ones? I just had it on the tip of my tongue. But anyway, what I wanted to ask you is why is namely lisinopril,
Lisinopril?
such a danger for folks of color?
Well, lisinopril is part of what we call ACE inhibitors, right? And so, I guess because of how it works, the pathophysiology of it, they tend not to be. You tend to have more problems in people of color. There's also a risk of what we call angioedema, which is when you get a sudden swelling of the tissues of the mouth. Yeah, or sometimes, but if it's the tongue, or inside the mouth, obviously that can interfere with your breathing, right? So we always get very nervous when someone presents with significant angioedema. If it's mild, then, we just watch you for 4 or 6 hours and treat you until, hopefully it will get better. But if it's severe, we may have to intubate you, put you on a breathing machine, because it will block off your airway and keep you, and if you stay home, if you start getting swelling, you got to come to the hospital, because you don't know if it's going to stop where it is or if it's going to get worse. And if it gets worse, and by the time you present, your entire mouth is completely swollen shut, then we can't intubate you and put you on the breathing machine. Then we have to do a crike or a trach and cut, put it into your neck, right? So in the emergency room, we'll do a crike. And the trach is when they take you to the OR to put the tube in. So if you're on any of these ACE inhibitors and suddenly start getting swelling in the mouth or the lips, you got to go to the hospital, because if it gets worse, that can be really bad for you. Does that help?
It does. And the reason I asked that question is because my husband was given an ACE inhibitor, namely lisinopril. And when he was being prescribed the lisinopril, I had told the doctor that I didn't think that it was appropriate for him, and he disagreed with me, and he gave it to him anyway. And so we were home one morning, and I was getting ready to go shopping. And it was like the 5th day he was taking the lisinopril. And he just happened to come down the steps, and I looked at him, and I was like, did you just take your blood pressure medicine? And he said, yes. And his face started to swell, his lips and his whole face. And of course, I didn't think I had time to call for the ambulance, so I put him in the car, and I drove him straight to the hospital. Of course, I yelled at the doctor when I got there, but they didn't have to trach him, but they did take him to the ICU because, his throat hadn't closed down totally, but he was having, a little bit of difficulty. So from henceforth, he was told that he could never, ever take a medicine that ends in pril. So he's never to have an ACE inhibitor again.
So, the thing, ACE inhibitors may work well for some people, and there's certainly benefits to it. And the problem with ACE inhibitors is that you may be on it for years and be just fine, and then suddenly develop angioedema, right? So there's no limit, My husband was on it for 5 days, but you could be on it for years, and it would be working perfectly fine, and then suddenly develop angioedema. So that's one of the risks with these ACE inhibitor type medications. Anything else?
I'm trying to think how to phrase this question. If it's a silent killer, and especially in women, it doesn't show up in any major symptom, and you can be walking around and sitting like we are right here, right now, I kind of think, I can understand why somebody would be a hypochondriac, where they go to the doctor for, they feel every little thing, because you don't know when a little thing is a big thing. Because how will we know? We're not going around. We have our annual checkup once a year, and within 12 months, something can happen. And so we're walking around with this silent killer in our bodies, and especially for us women, where we don't have those distinctive symptoms. It's a little scary when we hear this.
Are you going to say something? No. Oh, this is why I was saying, as adult black people, you should have a blood pressure cuff at home. They're not very expensive, and it's so worth it for you to check your blood pressure on a regular basis, right? Because some of us may not be aware that we have high blood pressure. There's some people who just don't go to the doctor, right? There's some people who think that because they're vegetarians, they're going to live forever and never have any issues. There's some people who think because they pray all the time, they're never going to have any issues. And this day and age, it just blows my mind, right? But the point is that, if you're not going to go to the doctor, at least check your blood pressure at home, because it's so common. It's so common, especially in black people. Remember I said, half of us in this room probably have high blood pressure. And that's an insane number, right? If you look to the right or to your left, one of you have blood pressure. No, not every day. You don't need to. If you feel lightheaded, you probably should check it. A lot of things can cause lightheadedness, but you know, you know, I think once a month is perfectly fine, if you have a kid at home. If you have or a tendency to develop hypertension.
Yes, Sister Joan, you are talking about hypertension being a silent killer. Indeed.
Frederick, we can't hear you.
Yes, because, yes, Sister Jones were talking about hypertension being a silent killer. So anything can happen between the first physical and the next one, next year. Actually, 2 days ago, something like that happened. My sister told me that, I'm going to die. And I said, okay, you know what? Lord, take the blood pressure. It was sky high. So good for us who have a pharmacy at home. I said, okay, give this and that and that. And then immediately, the blood pressure came okay. I said, okay, you may lay down. And then it went down from something above 185 over something down to 140. I told him actually it was too quick. But now the thing is that not everybody is knowledgeable. Not everybody has a pharmacy. Not everybody, probably some people will just take the patient to the ER. So good for us, we have everything. You know when it comes to emergency. So now this is indeed a silent killer. Because when she said, I'm gonna die, do something for me, the first thing I said, you know, Lord, get the blood pressure. And then now, I cannot say that luckily for her, but she had us around who can actually deal with that immediately. So that the prevention is that, as Dr. Wade just said, go easy with the salt. If you are a person who is sedentary, go ahead and just get involved with some activity, physical activity, 3 times a week for 30 minutes, you know, and then actually manage the stress. Some people come to me and say that, you know what, so much anxiety, so much stress, everybody's stressed out. Even a provider. Ask Dr. Reef, he's not stressed out. That's the nature of his job, right, Dr. Reef? Mm-hmm. But you have to manage the stress.
I see Pastor and Sister Pauline back. Okay.
Yes, Dr. Ray, you probably mentioned it before I got here, but I wonder if you could restate when your blood pressure gets to a certain number, where is the danger zone? We know everybody would like 110 over 80 or 70 or 120 over 70, but when should you get concerned and seriously concerned? What is that range you're looking for?
See, that's a very good question because there's no real true answer to it. Usually if your systolic is above 180 and your diastolic is above 1, if you come to the emergency room and I'm seeing you, I probably wouldn't get too nervous until your systolic is around 220 and your diastolic is above, like, you know, 120. That's when we get nervous. But we're emergency physicians and we see this thing all the time, right? A regular internist is going to get nervous way before then. But, you know, symptoms is also very important. There are a lot of people walking around with blood pressures of 240 or 250 over 150, and they don't even know it, right? And they have no symptoms. And there's some people who get a blood pressure of 200 over 110 and they have a stroke, right? And so it's different. They did studies on weightlifters, and you know during the what's it called, the foot press, like when you're pushing the weight with their leg, and their systolics were 400, and they didn't have symptoms. But it's during that time where that intense kind of activity. So everyone is different. And it depends on how long you've had the blood pressure for. If your blood pressure suddenly goes up that high, you'll suffer more of the negative effects than if it's slowly increased. And the reverse is also very important. If your blood pressure drops very suddenly, the brain has something we call autoregulation. The brain adjusts and gets used to a certain blood pressure. And if you drop the blood pressure too much, the cerebral perfusion pressure and the blood flow to the brain will get affected. So sometimes lowering the blood pressure too quickly is worse. And so if you notice your blood pressure being high, don't just double up or triple up on your medications, because that could be much, much worse than the regular blood pressure. And so a lot of times people will come to the emergency room with high blood pressure, and we'll let them relax for a little bit, and the blood pressure will go down, and we're not going to do much about it, because sometimes suddenly changing the blood pressure will be worse for them. So we may let them go to the doctor or start them on a low dose medications and work their way up, as opposed to suddenly lowering the blood pressure. So it's hard to answer that question, Pastor, only because, you know, it's different for everybody. But most times when someone goes into crisis, the systolic is above 180. So 180 and above, you should be real nervous. If I had to put a number on it, 180 and above, you should go see your doctor, especially if you have symptoms, chest pain or shortness of breath or dizziness or any kinds of things like that.
Lord.
Could you speak to that in relation to the age range also?
The age?
Yes.
The age range?
Somebody 30 years old as opposed to somebody, say, 50 or 60,
Yes.
70. I heard some discussions about that too.
We used to be a lot more concerned, obviously, with an older person presenting with certain types of things. But now I don't know what's happening, but the diseases we used to see in older people, we're seeing in young people now. And I don't know what's happening. We're seeing heart attacks in young 30-something-year-olds or having major heart attacks. And before, if a 30-something-year-old presented with chest pain, we didn't think twice about a heart attack. Now we're all thinking about heart attacks. They're presenting with strokes. All of the bad things you see in elderly people, we're seeing in younger people now. So whereas in the past we used to differentiate certain things, there's less of a differentiation now, because we just don't make any assumptions anymore with patients when they present with certain symptoms. Pauline, get Pauline first. Paula.
When is the best time?
Paula, please use the microphone.
When is the best time to take your pressure? Early in the morning?
That's I would say early in the morning.
Morning.
Yes. When you first wake up, your body is more at rest.
Okay.
Certainly not after you eat some food or salt or something. It would definitely be much higher. I saw silver too. Oh.
I think high blood pressure is what you eat. Well, I trouble with high blood pressure for years. And when I go to the doctor, I told them that my pressure is a little high. And then tell me the same thing. I tell them before. And the last time I go to the doctor, and then say, excellent! And I jump up. So he said, praise God. And then to keep it like that. But I cut off the regular salt for years, and I use the pink salt. And when I use the pink salt, I just use a little touch, and still my blood pressure always high. But me have a problem. I don't like drink water too. When I feel for it, I drink it. Mm-hmm. And now I start to force water now, and if I don't say the blood pressure down, maybe it could be the water help me a lot. Mm. So please, maybe what you put in your body.
Yes, for sure. Going back to that question the pastor asked in terms of age, Pastor, but it depends, right? As you get older, I expect you to have more atherosclerotic, damage, more damage, or more fragile blood vessels, or more fragile. So you may suffer the consequences of hypertension a little bit more than a younger person who hasn't gotten the damage, as much damage as yet over the period of time, So I don't know if that helps a little bit, but yeah, I see what you were saying from before. Anybody else?
Byron has his hand up.
Dr. Ray, it might have been mentioned.
Could you hold the mic to your mouth?
But what is the correlation between salt and high blood pressure? Why does it elevate?
Yeah, I see. How the kidneys work, if it's absorbed, if you have too much salt in your diet, usually it pulls water in with it. And so the pressure, it has to do with how the kidneys work. And the kidneys affect this renal angiotensin system. It's all hormones. And some of them may cause, those chemicals or hormones cause the blood vessels to constrict and relax. And so all of that contributes to your pressure. If the blood vessels constrict, the pressure inside the blood vessels will increase. If the blood vessels dilate, the pressure inside the blood vessels will relax. And so salt pulls volume into the blood vessels, and the kidneys get aggravated and affect all of those hormonal changes. And so all of those things combine to increase your blood pressure, if that helps a little bit. It becomes a very complicated thing. Himalaya? No, what did he mention? Salt. I don't know much about pink salt. I don't know if it has more sodium or less sodium, but it's the sodium huh? It has less?
And sea salt.
I don't know. So it's the sodium content that is really the problem, right? So whatever has a higher sodium content will affect your blood pressure more in a negative way. Yes, yes. If your blood pressure is too low, they may tell you to eat a little bit more salt, yes.
Yes. Earlier on, you mentioned that what caused the high blood pressure was too much sodium in your diet and weight increase. But, Dr. Ray, it's killing me. I'm going to make a statement, right? And I want you to listen.
Byron, could you put it? We can't hear you.
Okay, I'm going to make a statement and I want to listen keenly. When I was younger, right, I never sick. The reason why, listen, I want you to listen to this keenly, you know. The reason why I used to play soccer, I used to play cricket, I used to run the track and field, right? I used to climb trees, flick over on my feet, hang my body down, do whatever, push up on all these things. Let's put it this way, a lot of exercise, right? Nothing ever happened to me, right? I was perfect, 100% fit, right? Now, what I noticed, right? And this is what caused, I believe this is what caused all this vibration. Lack of exercise. Yes. The things we used to do when we were young, we stopped doing them. And these things cause our body to break down. And it brings on a lot of stress on our body. So, during the course of this week, I was looking on my social media page, and somebody mentioned, once you stop exercising and all these things, your body starts to get old. It sounds funny, but it's true, right? But your body, because I said, oh, some old ladies, and they are so fit, and they don't sick, they don't have no farmer, nothing. And I said, but when I look at it, exercise is very good. And because we lack of these things, all these things come up on us. High blood pressure, sugar, all these things.
Yes. So, I always tell people, when God created Adam and Eve, where did he put them? And what were they supposed to do in the garden? So when's the last time you guys did some garden work? No. Is it easy work? It's very hard work, right? Maintaining a garden is very physically, labor intensive, right? So there's a reason why God gave the perfect people exercise and work to do, because exercise and physical activity helps to maintain our bodies and helps to strengthen our bones. When you exercise, especially women who have osteoporosis, we try to get you to exercise more or carry more weights when you're exercising, because it helps to build up back the bones. So exercise helps the body physically, and the bones and the structure and the heart, right? People who exercise the heart works less hard, right? Your heart may pump twice to get the same amount of blood as someone who's in physically good shape, so their heart doesn't work as hard. And the more your heart works, the more stress on the heart, the more oxygen it uses up. And if the blood vessels start to narrow, then supply and demand may outweigh each other, and that's how people end up getting heart attacks. So good exercise affects every part of your body and keeps you in better shape. And this is why it's so important to exercise. Yes, Blake?
Dr. Ray, is there any relationship between hypertension and lower back pain. Because sometimes I don't have any back pain, then 2-3 months pass, and all of a sudden I got a back pain. I rub it with that, you know, what you call that stuff? Bengay. I might take a Tylenol. They said don't take too many of those. Then it goes in a week, so it's gone. 2-3 months.
You know, I don't know for sure if there's a specific relationship between hypertension and back pain. If you sit a lot, you'll probably get more back pain than regular people. As we get older, the muscles also are not the same. And if you have, you know, we get very concerned if you have really bad back pain and your pressure is very high, because, you know, abdominal aortic aneurysms may present with back pain and high blood pressure. So then we get more concerned. I'm not saying that's what you have, so don't start going crazy, because I mean, that's a different type of thing. But rarely ever do I know of hypertension causing back pain. You know, back pain may cause your pressure to increase, but usually not the reverse.
Well, Dr. A just said it. I was just wondering if he noticed that his blood pressure was higher when he was in pain, because it correlates. Pain does increase blood pressure.
Yes.
No, what happened? I don't take my blood pressure. I went to the doctor, visited the doctor, and this is a young doctor. And she told me, you're in better condition than I am. I'm 30 years old, and your body is better than my body. So I didn't want to go back to that doctor because, hey, you know, I mean, tell me something. She's 30 years old. She's a doctor. And here I'm 70-something. And she's telling me my body's in better shape than hers. That makes no sense to me.
You know, Blake, just like Byron said, we're not 22 anymore. You know? Yes. So somebody online was asking what's the relationship between high blood pressure, cholesterol, and heart disease. Well, the high blood pressure, remember we talked about the high blood pressure damaging the blood vessels? And cholesterol can build up plaque in the blood vessels. So the combination of high blood pressure and cholesterol may cause more narrowing or atherosclerosis or arteriosclerosis of the blood vessels, or narrowing. And narrowing of the blood vessels will decrease the blood supply to the major organs in your body and can contribute to heart attacks and strokes and these kinds of things. So high blood pressure and cholesterol is a double whammy. Right? If your blood pressure is high and your cholesterol is high, that's a double whammy. You're much more susceptible to heart attacks and strokes and all the bad stuff that we talked about before.
Yes, Elder, just a quick observation.
Yes, Brother Black.
I observe and I notice that when you go to your doctor and you get your first blood pressure checked by the nurse or whoever, remember the doctor going to do a second one. So by the time you see the doctor, you're much calmer. So if you're going a little bit up, you're going to show up. By the time the doctor, you're going to say it's fine. So you might ask, so it was high there because you calmed down. Another thing in terms of, you speak about kidneys. Over time, as we age, our age takes us into different stages of kidney disease. Am I correct? Therefore, a person who is in his 40s might be 1 and 2. 50, 60 might be stage 3. Am I correct?
Well, it's not just your age, right? I mean, it's age plus. You know, hypertension or diabetes or high cholesterol, all of these things can contribute to damaging your kidneys. You can be 90 and your kidneys can be functioning, not like a 22-year-old, but still functioning pretty good. But as you age, everything gets a little, yes, less as we age, yes. Right, no question about it. That's why I said earlier we're not 22 anymore, right? So as you get older, you know, your body will not function the same way. But if you try to live a healthy lifestyle, you know, you should be okay. Yes. 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 So if you have multiple health problems, we call them multiple comorbidities, and you really need to work with your doctor or with a pharmacist to adjust, to be careful about your medications, right? Yes, especially the dosages, because one medication may be good for your heart but affect your kidneys in a bad way. One medication may be good for, the kidneys but affect your heart in a bad way. So you really have to be careful. Sometimes doctors will just prescribe medications and they don't necessarily think about the effects of them on each other and stuff. And so it's important that you get that managed properly too. One in the back first.
Yeah, my question is two-part. Why are men so afraid to go to the doctor? And then the other one is there any correlation between a person that's on dialysis and hypertension?
So, why are men so afraid to go to the doctors? I don't know. It's just a man thing. I have no explanation for it. And especially to get like a prostate exam, that's even worse. And especially West Indian men. We will never go to the doctor to get a prostate exam unless our wife forces us. It just won't happen, right? It's terrible because we suffer the consequences of it, right? We get a lot more prostate cancers and stuff. And this is prostate cancer. The prostate is in a capsule that's very thick, and if you can discover prostate cancer early, you can prevent, the bad things from happening. But because we don't go to the doctors and get checked out on a regular basis, oftentimes it's discovered late when you suffer the consequences. Now, what was the other question? Oh, because earlier we talked about how, the hypertension will destroy your kidneys. And if your kidneys get destroyed, you'll end up on dialysis. Donna?
What about taking an aspirin a day? How does that help or hurt?
Like a baby aspirin. The doctor will tell you take a baby aspirin. And the regular aspirin is like 325. A baby aspirin is like 80 or 82 or something. 80? Yeah. So, so it's a big difference. But as we get a little older, if you develop, the aspirin helps to, thin the blood and help to prevent blood clots. And so your doctor will, help to prevent strokes, help to prevent heart attacks, help to prevent what we call, blood clots in the legs or deep venous thrombosis and these types of things. And so your doctor may say, hey, you've had a little mini stroke before, you should take this, or, take aspirin.
I was about to ask, Donna is asking if it's after something that happens to you or in general just to take it.
Most times, unfortunately, it's after something happens to you. But if you get a little older and your doctor says, you got a little high blood pressure or maybe you're obese or maybe you get diabetes, they may say, hey, you're a certain age, you should start taking this. Or the PSA levels. I mean, we have to keep in mind that most men, the older you get, the more likely you are to have an enlarged prostate, right? Above 60, 70, there's a good chance that your prostate is enlarged. But doesn't mean that that's not the same as prostate cancer, right? It's two separate things. Most of us will get an enlarged prostate, but much less will get prostate cancer. But still, it's on the rise and we have to, because we're missing it. Sister Luska?
Yes, Elder. Dr. Ray. When you have high cholesterol in your gene, is there a time you could tell me when to start taking medication for that? Or?
Well, yeah, if you can't bring your cholesterol down by exercising and modifying your diet and so on, and it's above 200 and these kinds of things, then they may start telling you that you need to take medications.
Yeah, doctor, but they said that exercise doesn't bring down high cholesterol. Is that true?
No, I don't believe that. I think exercise will help to control your weight and help you burn fat better. And so it all contributes to bringing down the cholesterol. but not exercise by itself. Obviously, you have to modify your diet, right? If you have a big fatty diet and you're consuming far more cholesterol than you need to, then it will never come down no matter what you do. But in combination with lifestyle changes and with modifying your diet and, you know, all of those things, and exercising, all of those things come together. My cholesterol was borderline, and my doctor told me to exercise more.
Oh.
So it does contribute.
If I have to exercise more, I wouldn't have anything left.
I just wanted to piggyback on something that Silbert said about water. I know a lot of people I hear don't like to drink water. I once read this sentence about water. The amount of water we put in our bodies, the water goes to the major organs first. So it's going to go to your brain and your heart and your lungs. So sometimes you may feel your arms or your legs hurting to go up the stairs. It could just be that you don't have enough water in your body. So water is very important. I just wanted to plug that in.
Yeah, it's very, I can't stress the importance of drinking enough water.
Even though it's annoying going to the bathroom.
What, 6 to 8 glasses of water away, they say will keep the doctor away. And water, I know, I've had a little health nugget on water before. It's so important. Water affects just about every tissue in your body is made primarily of water. If they were to take all the water out of your body, you're basically just dust.
Wow.
Right? And so you have to realize how important water is to have just about every process and function in your body. Pastor?
Yes, Dr. Ray. Could you make the differentiation between the two types of cholesterol? And the bad one, what would be some of the things that you want to leave out of your diet in order to control that or, lower the one that affects you? Because folks talk about cholesterol all the time, but not all cholesterols are bad.
Right, okay.
So make
I
the
see what you're saying.
differentiation.
So not all cholesterol is bad. There's HDL, or high-density lipoproteins, and LDLs, which is low-density lipoproteins. And so you want to have the ratio between the two. You want to have more high-density lipoproteins than low-density lipoproteins. And the doctors, when they talk to you about this, will usually talk to you about a ratio between the two. And that will, contribute to whether or not you need to go on medications or not, or whether or not you need to exercise or lose weight or watch your diet and these types of things. So yes, there is a difference between the two. And some people say HDL is the good cholesterol. Some people say LDL is the bad cholesterol. So just keep that in mind.
Lloyd, Florence has a question. 1 second, Florence, we can't hear you.
The water, and you drink water. A lot of times people don't want to drink that much water because they feel like they're going to the bathroom and it's just going through the system. So should you drink the water a little slower, or just sip it, or because you're going to the bathroom? I mean, it's just like run through you.
The problem, and I know exactly what you're talking about, because I feel like if I go like this, it goes right to my bladder. And, they say sipping, but a lot of times I find if I try to sip the water, I'm not going to drink as much as I need to, right? But if I drink like, 1 full glass here and a little later in the day, another full glass, then I'll get the correct amount of water that my body needs. But my problem is you run to the bathroom every few minutes. And there's nothing you can do about it, I remember my doctor told me, you know what I do with water? I go to the bathroom and I just pour it into the toilet, and I understand what he was saying, because it just runs right through some people, but that's part of drinking water, but it's still so important. That's the inconvenience of drinking water, but the benefits far outweigh the inconvenience. No. You're actually supposed to drink water 2 or 3 hours before you eat, because the water dilutes the digestive juices I'm guilty. I'm guilty. I know I don't do it as much as I should. But the water dilutes the digestive juices and make your stomach work harder to digest the food. So it's not good to drink and eat at the same time. Drink an hour or two before or after you eat. Uh-huh.
Okay. Problem. So I try to drink a lot of water. I'm not a water drinker either, and I should definitely be drinking the water. But I find that when I try to drink more water, my knees swell up.
Your knees?
Yeah, like I get swelling in my knees, or they hurt when I drink more water. So
Do you stand a lot? Do you stand a lot in your job? No?
I actually sit, but I walk up and down. So yeah, I don't know what's going on. But yeah, I find that sometimes that happens to me.
Yeah.
When I try to say, okay, I'm going to drink more water because I know I need it. And then I get like swelling. Like, I don't know, maybe something not filtering right.
Yeah, but it's hard to say. You know, it's hard to say exactly that. Some people get what is called dependent edema. So they stand long enough, they'll get swelling in the legs. Some people get edema if they travel long distances, you know, in a car or a plane or something. So people get edema for different reasons. I'm not sure why it's just focused on your knees. Some people, as they get older or they have arthritis, they have a tendency to build up water in the knees or the legs. So there's a lot of issues, a lot of things, kidney problems can cause that too. So a lot of different things can cause, you know, fluid to build up in the body.
I get my checkup and they tell me I'm good.
Yeah, but that's perfectly fine, then it's just you.
I don't know.
It's just
weird.
Keisha. But again, you know, the importance of drinking water. Water has no calories. Water is the best solution that you can consume. Water actually helps you burn calories faster, and water helps you to, and water is a natural appetite suppressant. So water will decrease your appetite naturally. So if you're trying to lose weight, you should be drinking a lot more water.
We're going to collect the offering now. Carol Ager.
Because it's really true that you can beat God's giving, no matter how you try. You can't beat God's giving, no matter how you try. Just as sure as you are living, that the Lord is in heaven on high. The more you give, the more He gives to you. So keep on giving, because it's really true that you can beat God's giving, no matter how
offering. Gracious Father, we just thank you for your goodness and your mercy. We thank you for this offering that has been collected. I pray that you will stretch it so that it can accomplish your work and that others will come to know you. This is my prayer in Jesus' name. Amen.
Thank you. Patty's just going to do this little presentation and then Pastor will speak and we'll close.
Dr. Ray, could you please join me? Dr. Ray, on behalf of the Women's Ministry Department, Sister Ray, and us ladies, we would like to say thank you for all that you do for us. Thank you for enlightening us, for educating us, and for always being willing to share your knowledge with us. And we thank you, and we just want you to have this. Okay, you're quite welcome.
And by the way, do you have a check in that? You have a check in there?
I don't know. My lips are sealed.
Dr. Ray makes sure there's a check in that bag. We received valuable information, valuable professional information here this evening that we didn't have to pay for. And that's one of the benefits of having a doctor in the house. And they are growing more and more. We really appreciate their services. I don't know if we might open a mini practice here, which is the next step. And then, you know, you're going to need a budget, but then, you know, you'd have to put a little bit more funds in your pocket. That one won't come free. But we thank you, Dr. Ray, and thank you, Sisters in Christ, for really usually stepping up and really making the ministry come alive here at the Jamaica Church. We look forward to the many more programs that you have in the bag for this year. There's quite a few that's coming up, and we all look forward to them when it's time. All right, all good things must come to an end. We've had a great Sabbath. I really was a little concerned this morning when I actually got up and looked outside. My wife had no idea what was going on. She got up ahead of me and was busy getting ready, not knowing what was going on. So I alone, emphasize, I alone had to go outside and clean up all of that snow. But it wasn't as bad as it was. It wasn't nearly as bad as it was on Tuesday at all. So that was nice. But we braved it. We braved it and we came out and we had a wonderful time. And so we're going to end the day downstairs with a nice farewell program for the Hyatts. I want all of you to be there and to, you know, say your goodbyes in the ways you know how to express it to them. And then, as the bit of an entertainment, what we're going to see is a fashion show, an international fashion show put on by the Pathfinders and Adventurers folks, the young ones. We will see that. Take a contribution, you know, to support them as they plan their fundraiser for the camporee this year. Okay? So, without any further ado, I'm going to ask you to stand all as we say the benediction. Let us pray. And now, Heavenly Father, for the blessings of the Sabbath, we thank you. For the mercies extended, we thank you. And for the assurance of a week with your guidance and protection, we thank you. Dismiss us from this place, but not from your presence. We ask it in Jesus' name. Amen. Please be seated for a moment of silent meditation. As you go, remember to pray for Brother Morris. Brother Morris, who had a brother who died not so long ago, has another family member who died recently. Remember him in your prayers. God bless you.
Okay, if you plan to be a part of the Bible Bowl this year, please, right over here. Just and I'm going to start calling names. Sister Agard, Sister Allison, Sister Lorna. I think I see Sister Diane. Did she leave? I saw her. Okay. And all our young people, just hurry up in the front. Julie. I know the young people are in the fashion show, so they went downstairs. So, but everyone else who's here, just quickly, if we can just quickly meet. Thank you.
Please remember we have brochures up front. Please get the brochures.
Please come and get your brochures. They're all out here. Nice booklets.